Hello and welcome to the Community Voice. I'm Fara. Today my guest is Dr. Stephen Fein. He is the medical director of Fem Infusion Centers by Heme On Call. Dr. Fein specializes in treating deficiencies of iron disorders, and we welcome him today. And he's a special guest, and I'm just so happy he flies in and out. He's all over the place. He's a real jet setter, but I'm so glad that you'll join us today to talk about the importance of iron and what goes wrong in our body and how you fix it at your new infusion centers.
Thank you so much, Farah. Thanks for having me today. It's a pleasure to be able to explain how this works and how iron infusions have made such an impact for women all over, and explain the process of how we can identify and treat everybody who needs iron.
And interesting because you're a doctor first, and then how did hematology become like your way of going and moving towards that as a profession?
So as you know, I trained at Johns Hopkins, and I was focused on making an impact for people all throughout my training. I figured out that hematology was an important area to help people. I started off being a leukemia doctor, and I've kind of morphed over the past few years into what we call a non-malignant hematology specialist, focused on bleeding, clotting, and iron infusions. And it turns out that iron deficiency is so common that it's a major need for people to find places to get iron and to identify who needs it and to get it to them.
And what were some of the problems that people go to you for? What kind of iron deficiencies have happened?
Most commonly, this is a problem that's faced by women who have heavy bleeding and also many pregnant women. It turns out 25% of all pregnancies are associated with low iron. And sometimes you hear about taking iron pills, but it turns out that many people need iron infusions to solve it.
So they come to you when the iron pills have failed or they can't tolerate it, and
Exactly.
just because you take iron pills doesn't mean it's going to solve the problem.
It turns out the body's only able to absorb a few milligrams a day of iron, and by the time you're late in the pregnancy, you might need an extra 1,000 milligrams to help you and your baby. So a few milligrams a day of pills, even if you can take it, doesn't do the job.
Oh, oh, that's very interesting. And Heme On Call, that was how we started together, and you've rebranded and you've really expanded to Fem Infusion Centers. So Fem, I guess, is female. If I'm a smart little journalist here, right?
Also, Fem explains that we're Fe, iron.
Right.
Coincidentally, my name, Fein, has iron, Fe
But
as
I'm
well.
bumped.
Yeah. So I've decided that it's sort of my destiny to identify and treat everybody who needs iron. And now it turns out, so this evolved first as a project to do telemedicine, and I was focused on identifying people who needed a telemedicine route to see a doctor, especially during the pandemic.
And that's when you started.
Started 3 years ago during the pandemic, and figured out quickly that women's health was really a place where telemedicine would make sense. We're talking commonly about young working women, young women who have children at home, can't make time to go see the doctor. So we set up a system where you can see us online. No problem. It was all covered by health plans, no problem. But then we soon realized that it was just as important to set up a system to actually set up iron infusions for people. Of course, that can't be telemedicine. You have to go in person for that. But we have it all now. We have a system where you see us online and then you come for an iron infusion.
Oh, interesting. And you started in one location, and now you've really branched out. You have two in Miami, Hollywood. Keep going,
Yep.
keep going. Blah, blah,
We're
blah.
up North Palm Beach and St. Petersburg. Our mission is to cover the country, and we're going to do iron infusions for everybody who needs it across the country. And we will see people online by telemedicine. We're licensed in most states, so we can already do that telemedicine portion. So far, the Fem Infusion Center portion of our practice is only in Florida, but we're looking towards expanding to other states soon.
And where are you located here? We're in South Miami, our studio here. So where are you in comparison to where we are sitting presently?
Very close to South Miami. We are at 8255 South Dixie Highway, at 67th Avenue in South Dixie. And we have a Hollywood Infusion Center on Sterling Road and near I-75. And then we've now recently opened in Palm Beach and St. Petersburg. We're doing 100 infusions a week, and we're looking to continue to expand it so that we can help everybody who needs iron.
And you talk here, one of your primary focuses is in women's health, hematology. And how does that compare to men? And what's the difference?
Yeah, thank you for asking me, Farah. It turns out that iron deficiency is really mostly a women's health problem.
Why don't men have this issue? I mean, Men, you got a lot of issues, but this ain't one of them, right?
So the gender inequality gap is mostly related to iron because women have periods and pregnancies. So just by nature, men don't have the reasons that women have to have low iron. There are some men who have low iron either because of gastrointestinal problems like inflammatory bowel disease, or people who donate blood frequently can have low iron. And special cases of people who have blood disorders can get low iron. But in total, it's about 1 or 2% of all the iron infusions are in men.
Mm.
And it's 98%
Aren't
women.
we
It's
we're really
women's health.
lucky. Yeah.
And the way I see it, we're solving a public health problem, first of all, by dealing with gender inequality, where women are more tired than men because of this. 25% of all women with periods need iron infusion. So women are tired. Maybe
That's a lot. Say that again. Say that statistic again.
25% of all women with menstrual bleeding have low iron.
And do they know they do?
People don't know it until they get tested.
And are there symptoms of low iron?
Commonly being tired and fatigued and not being able to do as much as you used to do, having low energy. The reason is that iron is not just important for the blood count, but also all your muscles need iron to contract.
But when you're a new mother, that seems like, oh, well, I'm tired, I have no energy, I'm feeling lethargic. That seems like it would just be one of the normal symptoms of.
You might just blame it on having recently been pregnant, but your baby took a third of your iron. So even if you had enough iron to give the baby, you're low because you just went through the pregnancy. 25% of all pregnant women.
It's amazing. So when a woman feels this way, what happens? What do you suggest?
So a woman who feels tired should get tested for iron. I say that every pregnant woman should get tested along the pregnancy. It's still not a standard thing to do. We're encouraging everybody, all the OBGYN doctors are encouraging them to test in the third trimester. And then every woman who has menstrual bleeding, even if it's not so heavy, should get tested periodically. I suggest once a year just to know that the iron level is adequate. If you get tired, it's already kind of too late. Like the iron is now so low that you really, really need the infusion.
Mm-hmm.
If you're not so tired, you can test and kind of catch it before you get tired.
And we also bring a point to weight loss surgery. What happens there? Some chemotherapy issues, which is also a male problem. And would that necessitate iron infusion?
Yep. So anybody who has weight loss surgery, which is gastric bypass or gastric sleeve, eventually you get low iron because you're not absorbing it well. And it's great that you can lose 75 or 100 pounds, but eventually you need to deal with the fact that your iron gets low.
And is it the same symptoms? You're tired, you're
being so
dragging.
tired. And what happens is that people eventually get so tired that they wind up in an emergency room getting a blood transfusion, when that can be avoided by getting the iron testing in advance.
And what kind of iron testing do you do?
It's the test called the ferritin, and also we'd like to do the iron saturation test. They're easy blood tests, and you don't need to see your doctor to do the testing. You can come free to us in our infusion centers.
Oh, free. You can come
walk
in there?
and we do the testing.
Oh, and is it a wait time or do we get the results?
It's sent to a lab, so it's a day.
Okay.
You have to wait a day, and then we contact you, tell you the results. And if you choose to see us as a hematology doctor visit, then we'll set it up online, see you on your phone, and have you come in for iron if you need it.
And what would be different than if I go to a general practitioner versus coming to you as my hematologist specialist and helping me get some energy and get my mojo back?
Your family doctor could do these tests. Some of them are a little more attuned to it than others. Sometimes you kind of have to ask them and nudge them and say, hey, I wonder if my iron's low. And I encourage every woman with periods to get iron testing. Of course, everybody who's had gastric sleeve, men or women, should get iron testing, and all pregnant women.
Interesting. And the name of Fem Infusion Centers, and you have done over 5,500 iron infusions since you started in 2021. That is a huge amount. Kudos.
Thank you. We've figured this out. So the system is that if your iron's low, we have you come in and do an iron infusion, and we see you back a few weeks to see how well it worked. We've gotten to the point where we've set it up so you can see us and get an iron infusion within a week of contacting us. And this is something no one's ever done before in the whole country. It's never been this easy to get iron. And we're so proud of this, and we know we have so much more work to do, because there are 60,000 pregnant women in South Florida, and a quarter of them need iron every year. So
and how many of them realize that they need that?
they don't realize it.
Until God forbid they're in an emergency
It
situation.
could be that they get to an emergency, or they're so tired, and finally their doctor says, "Hey, I'll test your iron just because you're tired."
Oh, interesting. So if those that are, so that's a lot of women.
Thousands of women in Florida and millions across the country need iron because of either pregnancy or heavy bleeding.
Absolutely. And your mission is to identify and treat all women who have this iron, low iron situation. And you talk about your 5-step plan to resolve, which I think is really, really, speak to that,
Proud
please.
of our plan. So the plan is to educate everybody about this, including right now as we're speaking, and also educate all the doctors and the nurse midwives who take care of pregnant women, and to get the word out. That's part one. Part two is to get people tested, whether it's your doctor testing you or come on in and get tested free with us. Part three is that we see you online as a telemedicine appointment and set up your iron infusion, and we get your health insurance to pay for it. Part four is we do the iron infusion safely and quickly. We get it done. And part five is we do follow up and see you a few weeks later and see that your iron is improved and your energy is improved.
Mm. So you're saying that this is covered by insurance?
Yep.
So it's all insurances, just you have to look on your website, which is
Our website, hemeoncall.com, HEMEONCALL, Heme On Call. At one point we were calling ourselves Heme Onc Call because we covered oncology, but our focus has now shifted all towards women's health. So we changed our name just to make it cleaner.
easier. 786-567-8310. We're going to have this running on through our interview. It's hemeoncall.com to get all the information. There's a lot of articles, a lot of information there. I was on there. I was amazed with some of the things I was finding. I had no idea as a woman who's pretty educated to know, but didn't know all about this iron treatment that you provide. That was just an amazing. And when you have this follow-up, is it usually warrant another treatment?
About 10% of the time, the first iron treatment isn't adequate, so we say, okay, go for another treatment to I say to kind of fill the tank higher. We kind of equate this like a gas tank that you're filling up your tank. But most of the time, the first iron treatment that we plan is adequate. And then our plan would be to have you get checked in the future just to see that you're staying adequate over time. Women who have heavy bleeding might get low again and need more iron in the future.
So you go to one of your infusion centers and you sit in a nice, comfortable chair. Tell me a little bit about the dynamic that women will, or some men, only 5% of you will be in the chairs of Dr. Fein's infusion centers.
We tried to make it a pleasant experience. So the most important thing is that you no longer need to see a cancer doctor and get an iron infusion. So that's what we've done. We've taken hematology out of HEMONC. So you come to our center. We're not a cancer center. We're not dealing with cancer patients, and we have.
Is that one of the side effects? Is low iron for cancer patients?
It turns out that yes, some cancer patients have low iron. So cancer centers do iron, and until now, you had to go to a cancer doctor or to a hospital to get iron. And we're the first in the country. Now we have 4 centers to give iron in a place that's not a cancer center.
Kudos to you. You must sleep really well. Look at that smile. That is fabulous.
We've solved a huge problem in South Florida. We've made it, I consider this to be a great service to all women in South Florida to come in for iron, and we're looking to do it throughout the country.
But what made you think of that? Like, how did, do you just lay in bed and go, okay, I'm going to start infusion centers and I'm going to call it Fem Infusion Center? Like, how does that start for you that you realized that there was this need that you filled, but how do you get to that point as a doctor?
As a hematologist, I noticed that there are many people who need iron but don't get it. They wind up in the hospital, or they're afraid or challenged going to a cancer doctor. And it just didn't make sense to me that that was our system, to have to force women, pregnant women a lot of the time, to go to a cancer doctor to get iron. And not only that, but a lot of the times the doctors who are dealing with this, it's kind of a lower priority to them. Like they don't see the woman as so bad that they really need it. When you think about how we're helping the woman and also her unborn baby, their development depends on having enough iron. It's such an important service. And I think that the oncology doctors who are focused on cancer, God bless them that they're doing such important work. But I think that it doesn't have to be a challenge for women to get the iron they need.
Absolutely, and it's very fitting. It's a very important opportunity to really differentiate yourself and to really be very specific in what you're doing and not have to go into a cancer institution to get that iron.
Nobody's ever figured this out before. Some of the things that evolved the past few years were the ability to do telemedicine as the central component of this. That was all because of the pandemic and because of the the improvement in technology and Zoom and our phones. So all that really pushed this over. And also, the past 10 years, the iron has become easier to infuse. It used to be a little harder with irons that had a higher chance of a reaction more than 10 years ago. Now the reactions are much less common. We see people get through this very easily. And so these past 10 years, the iron brands that have come out have been easier to receive. And thirdly, just a greater awareness of women's health and the desire to improve maternal health and baby outcomes. So just a big movement towards women's health understanding. The three main movements over the past few years.
Absolutely. And there are symptoms. We know you discussed the symptoms, but what is a long-term problem if one doesn't get treated for the deficiency of iron?
The most important thing from my point of view is that babies depend on iron to develop well. And we know that babies have a higher risk of developing cognitive problems if their mothers have very low iron. For example, ADHD and autism are associated with the mother having low iron.
Really? Wow.
It's incredible. Also, maternal outcomes, so heavy bleeding during delivery, needing a blood transfusion during delivery. So lots of things right there that can be solved by giving iron to pregnant women. And even that was a challenge for people to really kind of grasp these past few years, but we're finally getting the word out.
So it's very sometimes hard to change the paradigm, but I think you're doing that step by steps. You put your feet to the ground and you're moving forward. And it's really amazing to see this evolution. We've known each other for a couple of years now, so this is wonderful. The testing you say is easy. It's a simple blood test. It's important to know that iron testing is not the same as hemoglobin testing.
What happens is that pregnant women get their blood count tested at about 26 weeks, right at the time of the third trimester. But that is not the same as having the iron test, which is the ferritin. And a lot of times the doctors kind of equate them, and the pregnant woman kind of learn to equate them. And if it looks like your hemoglobin number is normal, you might think your iron is also normal, but they're not the same. Very important to have them tested separately. And we're working with the National OBGYN Society to adjust their guidelines so that they require iron testing, because it's so important for the baby. And the same goes for women who have heavy periods and low iron. The hemoglobin number might not be that low, but you can be exhausted because your iron is low. And even some people even have a normal hemoglobin and their iron is low. There's just a big disconnect, and probably 30 or so percent of people with low iron have normal hemoglobin. We call it iron deficiency without anemia. It's increasingly recognized as an important problem that your iron can be low even when your hemoglobin is good.
Wow, interesting. Those two have to marry to each other and balance each other.
It's been a crazy thing to explain that to people.
But that's powerful information that he's giving to us. You do testing for free for anyone who wants to come out to one of your centers, and now you're going to workplaces to offer free iron testing for all women between the ages of 20 and 55 years.
Any woman who has menstrual bleeding should have iron testing every year, and we're now on such a mission to explain it and to offer this testing that we figured out a way that we can actually offer it for free. Now, we would go to your workplace and we would set up a table where we draw your blood with your permission, and we tell you your iron test results a day later. So we have that set up. We're willing to come out to your workplace. We do it for free. We'll do as many women in the workplace iron testing as are interested in having it. We encourage everybody to get testing every year, and all pregnant women. Now, we're calling this a Working Women's Campaign, and the idea is that we're looking to help everybody get tested. It's just trying to take one step out of the whole thing about having to go yourself to get tested. We come to you now, and we'll do it if your workplace is welcome.
It's like, what a concierge service. I want my iron tested today, and Dr. Stephen Fein will be coming. But that's an amazing opportunity for women to really find out where they are. Maybe some of their stuff, they thought they were crazy. Why am I always tired? And I'm having so many problems. Is it linked to anxiety or depression at all?
It is. It is quite a lot. It turns out that when women are tired and not able to do as much, that could contribute to depression. And we know that iron deficiency is associated with depression and anxiety. And also, a lot of times women have weird symptoms, like sometimes chest pain or being short-winded or palpitations related to very low iron. And importantly and interestingly, women who have very low iron have ice craving if your iron is very low. So any woman in the workplace who's going to the office refrigerator for ice is probably has low iron.
That is so interesting. So you could break your teeth.
It could be. The dentist
But
saved
be
us.
aware that it can be an iron problem that you need to be dealing with.
Mm.
Women who are fatigued or tired are commonly found to have low iron. All women who have menstrual periods need iron testing every year, you said. All pregnant women should have their iron testing at 26 weeks. That's the third
Going into the
trimester.
third trimester, at the same time they do the glucose testing, it makes sense to just do it all together. They're looking to see who's got diabetes, and also they should look to see who's got low iron.
Absolutely. And this is a very, I guess, another hot button for you. And you're really excited about that because when we've talked off camera, teenage girls with heavy periods and the connection to low iron. And what are you doing about that at the Fem Infusion Centers?
Huge underserved problem and underappreciated problem. So first of all, many women have heavy bleeding and they just consider it normal, or they're maybe ashamed to tell people about it. They don't get help. Maybe their mother had heavy periods, so they just consider it to be the way they're going to be and be normal. And if you have heavy periods, then you end up having low iron. And when you have low iron, eventually you don't concentrate as well. You might not do as well in school on your tests, on your SAT test. You might not have as good an SAT score. So by identifying these women, these teenage girls who need iron infusions as a teenager, we think we're helping them achieve better, maybe achieve better in sports and school as well. And we've seen it. And we've started infusing teenage girls. And now we have a clinical trial that is open to all teenage girls with low iron, where we're monitoring them and seeing how well we're doing with it. Really focused on this. We're bringing the message to public schools and to private schools, and telling high school counselors to please encourage your teenage girls who are very tired or say that they have heavy periods to either come to us or ask your pediatrician for iron testing.
Absolutely. So these are wonderful partnerships for you to have with the medical community as well.
Yes.
So in the time that we have left, what we missed and maybe what you want to talk about and
So we are doing research in the whole iron situation. We now have trials looking to see what percent of all pregnant women in South Florida have low iron, and we're focused on identifying all the benefits of iron infusions in pregnant women. This is our main focus. So we have trials now associated with the OBGYN practices down in South Florida. And we are comparing the women who have low iron who receive iron from us from those against those who don't, just to get a sense for how much benefit the iron does offer. We know it offers a benefit, but it's not been well studied. So we're doing those clinical trials, and we are doing the pediatric study. And finally, we are opening a foundation that is offering more iron education and also iron infusions for those who can't pay. So we're going to have an invitation for people to donate. We're going to have some fundraising to raise money and have a foundation available to pay for those who can't afford it and have no health plan.
that's a beautiful thing for the future of your Fem Infusion Centers, Heme On Call. Wow, that's a mouthful.
It's a mouthful. Heme On Call, hematology on call, like here we are on call for you.
And you can get an appointment the same day, next day.
We usually can see you within a day.
Right.
So contact us today. Usually we see you tomorrow online on your phone, and it's all telemedicine. And then if you need an iron infusion, you come to our Fem Infusion Center, which is named for female and also because it's FE iron.
Get it?
Yeah.
FE iron.
It's that, and we're trying to make it so that it's just more and more accepted that this is something that women need. Women should think of iron as like they're going to the gas station to fill their car up with gas, because if the gas tank is empty, then it doesn't go.
Absolutely. And in this day and age, there's so much coming at us as women and men, but women and we're families and life and work. And so, sometimes you just need to address the root problem, which could be just an iron problem, which is simple. And you go into the infusion center and we sit in a chair.
30 minutes in the chair.
And what kind of bag is it? Is
it's
it like
a brown fluid, because iron is brown color.
brown fluid? That would really scare me.
It'd be a little scary. Brown fluid goes into your vein. A few people have a reaction every so often, like a little bit of discomfort while you're getting it, but you get through it just fine. Nobody's ever had a serious problem from us. And you get the infusion. We watch you for a few minutes to make sure that you're comfortable, and you go home. You can drive yourself home.
Is it like a half hour? Is
a
that
half
what it is?
hour.
Oh, it's a half hour. And then you come back in 2 weeks and you let me know how I'm doing?
In 2 weeks, we see you on your phone, but at that point,
You see me on my phone.
We have you go for testing.
Oh, okay. So you'll have it. Okay.
Yeah, we get the test results. So you have to go to a lab or back to our infusion center. We can draw your blood there, depending on which more
So
convenient.
so at that point it becomes a telehealth visit that you started and loved very
Yep.
much, and how this all brainstorm child
Mhm.
was created, right?
Telemedicine hematology. When it comes to telemedicine, hematology is the perfect match because we're mostly talking about your blood test results. I can show you on your screen, on your phone, hey, look, your iron level went from 5% to 20%, looks perfect.
So you don't need to touch. You don't need to
You need
touch,
to be in
and
person.
yeah, very interesting. Very, very interesting. So what's the future? I know you're doing your foundation, but tell me a little bit about the future.
It's the research projects, the foundation expansion throughout Florida. So far, we're in South Florida and St. Petersburg. We're going to be in Orlando soon.
Oh wow.
And then eventually looking towards the infusion centers in other states. No one's ever done this before, like we have, and now we've mastered it. So we think this should be easy to expand and do everywhere. Um, the challenges are educating everyone and convincing everyone of how important this is. And when we start in a new place that really has never known us before, it's really just getting the word out and doing education and marketing.
Oh, wonderful. Thank you so much, and all the best to you and Fem Infusion Centers by Heme On Call. It's just a pleasure, Dr. Fein,
My pleasure.
and continue spreading good FE in the world, and helping women and children, and so that we can all live a happier and healthier life.
Fill the tank with gas with the iron.
But it's brown, so I'm kind of like a little nervous. It could really be gasoline, but maybe it does. It gets me going, right?
You know something? Most people who receive the iron feel so much better within a week or so that they can't believe how bad they felt before.
Yeah, comparison
It's
before and after.
yeah, we do this and we're studying this as well, and it's well studied and known that uh, the iron infusion makes people feel a lot more energetic and have more strength and less shortness of breath, and be able to do more, have a better delivery for their baby, be a better mom when their baby's born. They're not as tired.
Wonderful. So it's hemeoncall.com for more information. Dr. Fein, thank you so much. I want to thank you for joining me, and I hope you have all the energy, health that you want. And if it starts with your FE, your iron, get tested, and great locations in our area. And for now, I'm Fara Sachs. This has been the Community Voice. Take care of yourselves and each other. Have a
Thank you,
great day.
Farah.
Thank you.